Everyone, my name is Rebecca Young. I will be discussing addiction, treatment, and how it affects our society. Addiction is a huge problem in our society, and getting treatment for these addictions helps with this growing problem. Society as a whole is affected by this disease. Treatment is the best option for addiction. Types of addiction are alcohol, prescription drugs, heroin, opioid, tobacco, shopping, sex, internet, gambling, and food. In America, the incarceration rate for addiction, there are around 5.6 million Americans in prison, in jail, on probation or parole in the United States for drug charges. So this is an ever-growing problem for the society. Addiction affects everyone, not only including the children, but family members of everyone included. There are an estimated 1.7 million to 2.7 million children who have a parent incarcerated at least once in their childhood for drug charges. As you can see, drug usage among Americans ages 12 and older, which 12 years old is very young. For marijuana, you can see that the usage of a lifetime is 45.7%. Used in the last year is 17.9%. And used in the last month is 11.8%. For cocaine, usage in a lifetime is 14.2%. Usage in the last year is 1.9%. And usage in the last month is 0.7%. For LSD, the usage for the lifetime is 10.2%. Usage in the last year is 1%, and usage in the last month is 0.2%. For ecstasy, the usage in a lifetime is 7.4%. Usage in the last year is 0.9%, and usage in the last month is 0.2%. Methamphetamine, usage in the lifetime is 5.6%. Usage in the last year is 0.9%. And usage in the last month is 0.6%. And for heroin, usage in the lifetime is 2.3%. Usage in the last year is 0.3%. And usage in the last month is 0.2%. And you can see that over the lifetime, the percentages are all higher. Youth who have used opioids in the last year. For heroin, it's 0.3%, which is higher for 12th grade and above. For 10th grade, it's 0.2%, and 8th graders, it's 0.2%. For Oxycontin, it's 2.4% for 12th graders, 1% for 10th graders, and 0.9% for 8th graders. For Vicodin, for 12th graders, it's 1.2%. 10th graders, it's 0.9%. And 8th graders, it's 0.5%. Which these percentages are lower, but it's still something that continues a lot of times on into adulthood. For this graph, it breaks it down a little differently into age groups for prescription drug usage by 12 to 17 years, 18 to 25 years, and 26 years and older. For the 12 to 17 years, stimulants are 1.7%, sedatives are 1.8%, benzo is 1.5%, pain relievers is 2.3%, opioids is 2.3%. For the age group of 18 to 25 years, the stimulants are 5.8%, the sedatives are 4.2%, benzo is 3.8%, pain relievers is 5.2%, opioids is 5.3%. For 26 years and older, stimulants is 1.2%, sedatives is 1.9%, Benzo is 1.5%. Pain relievers is 3.4%, and opioids is 3.6%. Addiction treatment is the best way to help recover from any kind of addiction. There's all kinds of different treatments out there. The beginning would be detoxification. There's counseling and behavioral therapies. There's rehabilitation programs. There's medications, group therapy, and individual therapy. It just depends on what works best for the individual person. Talks about addiction recovery. There are 23.5 million adults ages 18 and older who are in recovery from alcohol and drug addictions. That's 10% of the U.S. population, which you can see on the graph. Most never receive the help they need. Only 11.2% receive help for their addiction in specified facilities. People have to be ready to recover. They cannot be forced. They have to be ready to go in and do the work that needs to be done to recover. A lot of times, for different reasons, people do relapse, but in the same that they also do recover. People do recover from addiction. And to say again that addiction is a real problem for our society, and it not only affects the addict, but it also affects the family members and especially the children of the addicts. But people do recover when they are ready. And I just want to say thank you for everyone for watching.